Hello, I'm David Kerr, Professor of Cancer Medicine at the University of Oxford, and I've just come back from Ghana. It was my great honour to work with my friends and colleagues, Professor Beatrice Wifei, Professor Will Noir, and Professor David Collingridge, to launch the Lancet Commission on Cancer in Sub-Saharan Africa. I think this is a fantastic piece of work. It involved more than 50 senior colleagues drawn predominantly from across Africa, but with support from the global cancer community, representing 24 different sub-Saharan African countries. And we worked together for over a year to produce a report which we launched in Accra under the auspices of the First Lady of Ghana and former President John Kufuor. It's a fantastic event. It was well attended, both in person and online, and has generated much interest. It was an opportunity for us to capture the experience of my brothers and sisters in positions of power across Africa, to be able to condense this into a report, providing a snapshot, a look back as to how cancer control isn't working in sub-Saharan Africa, but with some very clear actions as to how we should move forward. Of course, we make recommendations around cancer registries, we hope with support from IARC. Unless we have the data giving us a clear idea of what's happening within different countries, different regions, how can we plan cancer services? We would like to have, I called it precision national cancer planning, in that we adapt each cancer plan. We may have a broad template, but we must adapt it to the situation faced by individual countries. Of course, we're looking for sustainable funding, and that's why we need joined up government with health, with education, with finance minister, with policing, transport. We need a joined up governmental approach to see what we can do. Of course, we want to improve the quality of cancer care, but with a focus on prevention. I've said many times before, when I was a very young fellow in Glasgow visiting with my friend Twalib Ngoma in a cancer centre in Tanzania, then 80-90% of patients were presenting with stage 4 disease, and that's similarly so 30 years later. And whether those patients were treated in Oxford or Dar es Salaam or Harvard, the outcomes would be broadly similar, because we would be beaten often by the burden of disease. Pediatric oncology, we made a special case. There are some great African leaders. My friend Lorna Renner from Ghana is an outstanding pediatric oncologist, and who's made great commitment, who's made great advances in the field. But there are far too few of her, so let's cure the curable, thinking of it that way. Early detection, lateral thinking about how we screen, using available workforces, working with traditional healers, so-called witch doctors, making them part of the solution rather than a problem, where many African patients still believe that cancer, again in many African dialects there's no word for cancer, but they believe it may be caused by witchcraft, and they spend too much time with traditional healers, allowing the cancer to advance well beyond the point of curability. Of course, we need to look at infrastructure, staff, training, kit, equipment, but that would be included in the National Cancer Plan. But we need to do something about flight of talent. I work within our National Health Service, and we are well served by African nurses, doctors, healthcare professionals, and we need to find a system of incentives that allows these excellent medical professionals to practice within their own countries and to deliver care in that way. Innovation and research, we know that our African colleagues are keen to contribute to global knowledge, and with support with North-North, North-South, South-South partnerships, academic, we think that we should be able to build alliances and networks that would allow us to do that, particularly in the field of implementation medicine, something which I've talked many times before. I think telehealth, telemedicine is another a rapidly advancing field of medicine that we should be able to embrace. So I'd be grateful if you'd have a look at the report. please comment on it. The solutions, help, support, any ideas that you've got would be gratefully received. The other thing that I've posted in addition to this video is a new discipline that I've invented, and it's called dancing diplomacy. Everywhere I went in Africa, I was invited to celebrate what we were doing in dance, and therefore, for your amusement, and for your amusement only, we've posted a video of me attending one of a fantastic event with breast cancer survivors in Kumasi in the north of Ghana, and you'll see that I've got rhythm and that I can move. Please don't call it dad dancing, call it dancing diplomacy. Listen, thanks for listening. Please make comments, not on the dancing, but on the Lancet report, and hope to speak to you soon. Thanks for just now. Bye-bye, and thank you.